Hey everyone, it's Rena Jadov here with Dr. Peter Osborne on the Book Master class for No Grain, No Pain. And this one is all about what else might be causing pain beyond the grain and the food. Dr. Osborne, what have you found in dealing with a lot of your patients? What else causes pain?
Lots of different things. Mold toxicity in the environment. If you live, like so many people in Texas, in South Texas, we live on the Gulf. We see it with Georgians in Mississippi and Alabama and Florida. Lots of mold in the homes. It can grow in the home, emitting mycotoxins that can create chronic illness. That's one thing beyond food, right? We see heavy metals, lead and aluminum and mercury and arsenic and cadmium are very, very common. Thallium toxicity is very, very common. So we see people with heavy metal buildups internally. They bioaccumulate these metals from the environment over the course of their lifetime, and their illnesses make it harder to detox. So it's easier for them to accumulate metals once that accumulation begins. And it can be very disruptive of their chemistry, very disruptive of their health. So those are probably two of the biggest ones that we want to make sure that we're testing people for, especially if their history where their home is flooded or, for mold, or if they have a history where they've worked in a factory or they've worked in an area or they've had more shots or vaccinations than the average person. Some of these shots have mercury and cadmium in them. So we want to take that history into consideration. But one other thing is food chemicals. So I shouldn't really say food. I should say what people get in their food. So food dyes, food preservatives. There are a number of different compounds and chemicals that are used consistently from day to day in the industry. For example, when you go and you buy a jar of pickles at the grocery store, one of the food preservatives is sodium benzoate or benzoic acid, which for some people can pose a very, very big problem. So we also test for those as well. We test to see if a person's reactive to food chemicals, if they're reactive to environmental chemicals, what's in their perfume, their cosmetics, etc. We want to know if their exposure to heavy metals is high, and we want to know if they have mold toxicity. Those are some of the main ones.
What about emotions? Have you gone into that area of helping people that might just carry so much emotional baggage that it's manifesting as pain?
I have, yeah. I'm a doctor of pastoral science as well. And so we oftentimes do get into emotions and lifestyle because for some people, it's just as important as food. And for some people, it's more important. They don't have so much of a food problem, but they're in an abusive relationship. They're in a job that sucks their soul every day, and they're just not happy in their fulfillment and their purpose in life. Or they've got some past traumatic history that they haven't coped with or they haven't dealt with efficiently or effectively. So emotional trauma can be a major, major contributing factor to these folks as well.
Great. All right. Well, on the next one, we are going to be talking about how to find the right doctor. And it's because so many times conventional medical doctors don't often have the same training or the same, I guess, practice that functional medicine doctors do. And so make sure to tune in to know what is the right question or what is the right framework to use to picking your doctor to get to pain-free life.